Hey everybody, I'm Terica,
I'm Mikhail.
and welcome back to Shades of Health podcast. This is episode 2, Healthcare Meets Hashtags, the impact of social media. So we know that social media plays a major part in everything we do today. But we're gonna tie it in and talk about how it affects healthcare.
All right. So, first question. Is social media becoming a new age healthcare advisor? And if so, how much should we trust health advice that we see on platforms like Instagram or TikTok?
So yes, social media is definitely the quick go-to now for health advice just because it's so accessible. So
Mm.
it takes 5 seconds to Google, you know, any side effects you're having or any condition you're having. WebMD is everybody's kind of go-to. I Google everything. I'm not gonna lie. I like to know, but it's also about knowing, like, is your source reliable? And I think that's where the issues come in for a lot of people. There's a lot of creators and doctors and dietitians that are sharing information online, but some of them lack credentials and they also are spreading misinformation. So it's risky to trust a lot of what you see online. What do you think?
I agree. It's so hands-on that people can just, like you said, get on in seconds and Google their issues,
Right.
their problems, which is helpful, but also you have to fact check these people to know if they're actually on par. Because everybody's condition is different, everybody's body is different. There's different factors that they have to, put together to make sure that it is good for you. Um, how much should we trust health advice when we see on platforms like Instagram, TikTok? I would say be very leery. Especially if
Yeah.
these people are just regular individuals. Like, take it
Right.
with a grain of salt.
Yeah, I think
Especially
it's
quick.
important to, like, cross reference
Mhm,
your sources. So if somebody is saying it, checking it with a reliable source. And WebMD honestly isn't, I mean, it's not a bad source, but it doesn't individualize, based on you.
mhm,
And so always checking with your provider, if it's especially if it's something you think is serious. Um
mhm.
it's super important. So
Yeah,
yeah.
I agree. Alright, you can take this one.
Alrighty. Are people more likely to self-diagnose or self-treat because of what they see on social media?
Yes, it is so much easier to diagnose yourself and to treat yourself based on, like, certain symptoms or, like, I know especially on Instagram, you can see, like, people having these issues. Like, if you're having this and
Mhm.
that, I've had, they have the same problem and they think they have the same issue. So
Right.
because they're putting those symptoms together and
Um,
they identify with them, then it's like, oh yeah, well, this is what I have, and this is what I need to do to treat myself.
right. Right. Studies show that people are more likely to skip professional consultations and instead follow DIY solutions online.
Mhm.
And it may seem harmless for, like, minor issues, but it can lead to misdiagnosis and inappropriate treatments, for, like, serious conditions.
Mhm.
There's a hashtag TikTok made me try it. And so, people are just really doing whatever they see online.
Mhm.
And it can get risky, as we said. So
I also think because I've been seeing this kind of like a Facebook ad or maybe on Instagram too, where like these influencers are saying, like, for women, if you're having these symptoms like BV or maybe yeast infection, these are things that your doctors don't want you to know. Like, you got to be weary of stuff like that, because why wouldn't I want to tell you what's wrong with you? Or, like, why are y'all trying to make it seem like we're trying to hide something from people? Like,
right, right. And I mean, you're speaking from a provider standpoint, right?
mhm,
So yeah, I mean, people are just healthcare, well, they say nurses are one of the most trusted professions. And so a lot of times people will believe what a nurse says before they believe what a doctor says, which is kind of surprising. In some ways. Um, but yeah, I think a lot of people have that notion that information is being kept from them or hid from them. And that's not necessarily always the case. So it
Mhm.
can get
Yeah, it's like it's creating that it's healthcare scam culture again, like creating
right, right,
mistrust in the system. Like we're here to intentionally harm you, and like you said, to keep things back from you. And it's never the case.
right,
Most times,
right.
it's never the case. Like my job is to help you.
I agree.
Yeah.
All right. Do you think social media is fueling comparison culture? And how is that impacting mental health? Does seeing perfect lives and bodies online lead to anxiety and depression? Absolutely. Um, Social media definitely creates this unrealistic beauty and lifestyle standards. You see the 6 foot guy with the abs who works out 5 times a week, 6 times a week. You
Hmm.
see um the woman in the two piece, and um it definitely, as humans, like, we tend to compare ourselves, right? And so it's hard with social media to be able to differentiate between fantasy and reality, and what the average person is going to be or look like, I should say. And so definitely heightens anxiety and depression and body image issues, especially among like young teens and adults.
Hmm.
So
So yeah,
yeah.
absolutely. Comparison culture. Let us say the comparison is the thief of joy. So like if we're
Hmm.
on these platforms 3 and 4 hours of the day or more, everything that our eyes see or our brain is seeing are images of things that we're comparing ourselves against, even
Right.
unintentionally. You know what I'm saying? So if all you're seeing is people are rich, in shape, and they're beautiful, then it's going to impact you because you're going to be like, well, I don't have money. I'm what, 25 and I'm not a millionaire. What am I doing wrong? Or,
Right. Right.
I'm 50 and I've had 3 kids, but I can't get my body back to where I was when I was 25. Like there are unrealistic expectations, and half of this stuff is majority of it is fake.
It's fake. Yeah. I mean, you will be surprised um the lifestyle that people live behind the screen, right? And so people portray that they're all these things, they're rich, they're beautiful, they have a gorgeous body, but then they're not even happy with themselves. They have all these internal struggles. And so we have to be very careful about the reality and fantasy. It's easy
Mm-hmm.
to portray on social media. So,
Mm-hmm. And another thing, like the anxiety and depression part of it, anxiety is coming from probably the looping of seeing so many different things in a short amount of time, and that affects your
right,
brain where your attention span is I guarantee you our attention span is a lot shorter than it was, you know, years ago, a few years ago versus, because we
right.
only can pay attention to something for like 2 or 3 minutes or less. And
Hmm.
so that's probably, if it's affecting adults, I know that it's affecting children and teenagers, because their brains aren't even fully developed yet.
Fully
So
developed. Right, right.
you're talking about ADHD, you're talking about definitely depression, you know.
Hmm.
And I think the Surgeon General is trying to come up with a law or pass some type of rule where um they're not necessarily banning social media, but like there's like an age limit, and I think right now it's 13 for most sites. But like
Okay.
really put a disclaimer out there because it's affecting the mental health of children with them being
It
exposed
is
to inappropriate things, them learning
so early
information
on.
so early, like it's
Right.
really affecting their mental health. Was I think I read the compulsion, they having compulsion, ADHD, unable to like communicate like with other children at their age. It's a lot. I think we could do a whole nother
Right.
segment on it.
Oh
All
yeah.
right.
Oh yeah.
You
For
got something else?
sure.
Go ahead.
No, I didn't have anything else on that. I wholeheartedly agree though.
Okay.
I'll let you take this one.
Okay. What's more dangerous, health misinformation online or the fact that people believe it without question? Go ahead.
I feel like both are equally dangerous.
Mm-hmm.
Um, the speed at which misinformation can spread is alarming.
Mm-hmm.
But what's equally scary is that people don't question it at all. You can post something on social media and it's viral within hours, right? And so who knows how many people have seen that misinformation and who are taking action on that misinformation.
Mm-hmm.
Um there was a recent trend of people using sunscreen only on the high points of their face,
Mm-hmm.
uh, which is dangerous because
Mm-hmm.
why would like every part of your face is, prone to the sun, prone to sun damage. So it ignored that, and that trend, at least it ignores the risk of skin cancer.
Mm-hmm.
Um, and misinformation like that is why it's crucial to verify advice before you follow it.
Mm-hmm.
Um, but yeah, so
Okay. I think people believe in the information without question is scary to me because you're not critical thinking, you're not cross referencing, you're just taking this stuff as fact. Like these
right,
people have gone to school, they've trained, they've studied for years, they've did like, studies on it. Like y'all taking people's advice that are just random everyday people who more than likely are just getting paid to for viewership and getting paid, to promote a product. You know, they really don't have your
right,
best interest in, mind. It's really if I can get this many people to watch me by being controversial, then I'm gonna say whatever, because money, people are
right.
after money and views pay,
Mhm.
So I really be careful with just taking information and not questioning it.
Yeah, yeah.
Go ahead.
Um, what's a piece of health advice that you've seen online that's totally off base? I know I talked about the sunscreen,
Mhm.
but I
The
think we were
vaccine.
mentioning
We
it.
talking about
Yeah.
vaccine? Mhm. Go
Yeah,
ahead.
yeah. We were talking about vaccines, which vaccines could be a totally its own episode. We could talk about vaccines, but according to the Autism Science Foundation, there is no link between vaccines and autism.
Mhm.
And I can't stress enough how stressful it is, I think, for parents, especially new parents nowadays, just deciding what is best for their children. And a lot of younger parents do tend to rely on social media. Um, as a nurse, I was actually on a travel assignment and we had a patient come in who was diagnosed with measles, which we know that measles can lead to brain damage, and that patient unfortunately did pass. And just the emotions of that mother who had regret of not vaccinating her child, it runs deep. So we just have to educate ourselves, to each his own. Um Parents are going to decide what they want to do and what they feel is best for their child, but um we just have to educate ourselves and know the information, know the research for yourself. It's super important. So
Absolutely. And like this is health literacy month. So everything that we're talking about are it's information for you guys to go and educate yourselves. We'll also be posting some links from credible sources where you can like educate yourself on vaccines. And what else? Probably other things as well. So just be
yeah, it's
checking us
also
out.
we'll touch on breast cancer. We know it's breast cancer month. We'll touch on that too, but
Absolutely.
yeah.
And I just looked up the CDC about measles being on a rise, and they said in 2023 there were over 300,000 cases of measles worldwide. And at one point they
Mhm.
thought measles was eradicated because of the vaccines. But
Right.
y'all, vaccines have been tested for centuries and they are very safe. Like
Yeah.
Terica said, there is no link between vaccines and autism. They have been thoroughly tested.
Mhm.
There are rare
Yeah.
adverse reactions, which means like side effects from them. They say they will
Right.
save your life. And like
Yeah, I mean,
the
especially for things like that. I mean,
Mhm.
I understand people being more weary of newer vaccines. Um, we won't even touch on COVID vaccine, but as you know, there's a lot of controversy with that. But the tried and true ones, and also like with autism, so we know that autism is quote unquote on the rise, right? But is
Mhm.
it truly on the rise, or
Better
like
test it.
have we gotten better at diagnosing?
Mhm.
Is there more criteria or data collection tools that
Mhm.
can say if a child has autism? So we because our generation, like, it wasn't as big, right? Or you didn't hear about a
Mhm.
lot of people, at least when I was in school, that had autism, right? Or even
Mhm.
ADHD, like that wasn't a thing, you
Mhm.
know. And so now more children are being diagnosed and they're saying, oh well, more people are having it, let's link it to something, when in reality, a lot of us probably, or a lot of people in my generation probably did have it, but it just wasn't being
Right.
tested for, right?
Mhm.
So I think
Mhm.
that's something we have to look into, the bigger
Mhm.
picture. So yeah.
Absolutely. And being in practice, I'm seeing a lot more people like waive their rights, not rights, but waive their kids from getting vaccines. And I think we've gotten to the point where we're dependent on the community, the herd effect. But that's going away
Mhm.
as much as well, as long as people are stopping. I'm saying that wrong, but basically, the more
Yeah.
people that stop their children from being vaccinated, the less people will have the vaccine, which means that community effect is no longer there. So, and
Right.
these
Right.
these illnesses are dangerous, and we have vaccines because most of them we don't have treatments for.
Right. Yep. Yeah.
So once you catch them, you got 'em.
Right.
All right.
Yes.
Who's laughing, Terry? All right. Are there
All
specific
right.
platforms where health misinformation is more prevalent?
Definitely TikTok and Instagram.
Mhm.
They seem to be the biggest culprits, just because of their short viral nature of the content. So you can make a 10-second clip, how to lose 25 pounds in 2 days, which is an extreme one. But like, they make these very catchy titles.
Mhm.
And that is how the misinformation starts. Um so yeah, and then you don't have time to fact check it because you're drawn in at that time. So
Mhm.
definitely TikTok and Instagram, I would say.
I agree. I think Facebook is more of an older crowd now. Um,
Yeah.
I'm not seeing as much misinformation, but I know a lot of people. I've had patients come to me after they've taken some TikTok advice and they're in a situation. And so, like, and I always ask, and not judgmental or anything, but I'm like, what did you learn from this situation? You can't take all advice, because now
Right.
you're still back at the doctor's office. So you
Right.
really, again, I think the main point that we're driving is fact checking, and not just taking
Yeah, fact
information
checking.
blindly. But yeah, definitely TikTok because it's very catchy.
Yeah. Have you heard of Reddit? Are you familiar
Mhm,
with Reddit?
mhm,
I actually love Reddit. I'm not gonna lie,
mhm,
but they do have a reputation for unverified health discussions.
mhm.
But I love some Reddit. People
Mhm.
be dropping some real interesting information
Yes,
on there. But as our overarching advice for this episode, please fact check everything. So
absolutely. And I will
yes.
also say, like, with TikTok trends, you'll have people that like will verify or have like reviews. You can't always trust
Mhm.
that either. Like, because
Right.
go ahead.
We have to
Oh,
remember that healthcare is individualized. No, I was just agreeing with you. Yeah. So what works for one might not work for you, but that doesn't mean it doesn't work.
mm-hmm.
If that
And
makes
they could
sense
not
too.
be,
So,
yeah, and they could not be given the whole picture either. Most of the
right,
time,
right.
like, yeah, I
I
lost
agree.
10 pounds in 2 weeks, but I also changed my life. I wasn't eating this, I didn't do that.
Mhm.
It's a lot of pieces of the puzzle that are probably missing.
Right, right.
All right, so
All right. For you, Mikhail, is social media making us better patients or just more paranoid?
mm, I think a little bit of I'm gonna say a little bit more paranoid because um I, so many people are coming in with symptoms that they think is causing them to have, like, so basically I had a person come in and was like, I think I got lupus. And I'm like, why do you think you have lupus? Well, I Googled and this is what it told me. And I was like, well, these are
Yeah.
the actual signs of lupus, and you don't have any of these things. He was like, but I got health anxiety. I'm like, health anxiety? He was like, yeah, now I'm just, every time I see something, now I got to come get checked out because now I think I got this, and that. And I'm just like,
Yeah.
I think it is creating some health anxiety because now, like, we're so focused
Mhm.
on symptoms that are very vague, you know, that either they're thinking they have something. I think it's making us pay too much attention to things that are not necessarily big situations. And that, I'm not saying
Right,
not to
right.
pay attention to these things, but I'm saying, like, just kind of take a step back and breathe and be like, okay, is this normal or is this not normal for me? Does that make sense?
Right, right. Yeah, I think it is walking a fine line between being informed and then paranoia.
Hmm.
I appreciate when patients look up stuff online,
Hmm.
but and they are better patients when they ask questions, or they
Hmm.
have a better experience, I should say, when they ask questions. But some patients are hypochondriacs for sure. Like the unnecessary panic, unnecessary worry, then which leads them to neglect professional advice because in their mind they already know what's wrong.
Yes.
And so we really should call it cyber country. Like, because you searching symptoms online and then you got this anxiety. It just
Hmm. And
it
it's
can get really really sticky.
hmm I didn't mean
So
to cut you off, but
no, you're fine.
then it creates this cycle, like, okay, goes back to, is healthcare a scam? Because now you're coming in asking me to run tests on you that I'm telling you are not necessary and they're very expensive.
Right,
So,
right.
like, is this normal for me or is it not normal? A headache or, a cough for one day, like, give it time to see if it goes away. See if an ibuprofen or a Tylenol may help before running your bill up, if that makes sense.
Yeah, yeah.
All righty.
All righty. What are some red flags that indicate a piece of health advice on social media might be unreliable?
It
No
goes back to what
credentials,
yep, go ahead. Go ahead, Tara.
no credentials or expertise. They are, an average Joe. And now I'm not saying that your common person can't share their story. Okay. Like people have experienced things like if you're, a lupus survivor or a breast cancer survivor, or, you have endured a situation and you want to give your advice or tell your story, I should say. That's fine. But people just need to know that, that is unique to you and it might not apply to them. So
Mhm.
I'm not anti people telling their story and what they've been through at all. But yeah.
Mhm.
Um if it promises a quick fix, like cure
Absolutely.
your acne in 24 hours, yeah, might might be a red flag. It's probably not gonna work. You know.
Mhm.
Um What's some other ones? Extreme diets and detoxes
Mm-hmm.
with no scientific basis. That's a red
Absolutely.
flag.
Very, very.
Um, blanket statements like this works for everyone. If
Mm-hmm.
it says this works for everyone, I guarantee you it does not. Because that just takes away from the individuality,
Mm-hmm.
like that everybody is different. So,
Absolutely.
but yeah, those are some of the ones I could think of.
Yeah, I mean, pretty much quick fixes, miracle cures, like you said, the acne thing in 24 hours. Like if it is curing acne, it's probably your skin probably being peeled off. Like it's
Right?
probably very extreme. And then you
Yeah,
got another
yeah, for
problem.
sure.
Over
Exactly.
simplification of complex health issues. So most health issues are complex. Like it's not just very
Mhm.
simple thing. You know what I'm saying? Like very few things are simple or can
Right.
be fixed in those manners, which is what we call acute health situation, visits or sore throat. You might have strep. And then those things can be complicated too, depending on, different factors. So like you just like Terica said, you just want to be careful with quick fixes, miracle workers, people that don't have any credentials, people speaking on with extreme language, like this is something that healthcare don't want you to know. Like we ain't got to do all that.
Yeah. Right.
Just if it's too good to be true, more than likely it is.
It probably is. Yeah.
And if it is something
I
very,
agree.
very good, it's going to be very expensive, more than likely, aka Ozempic
That's
and
true too.
Mounjaro. But that's a whole nother topic.
That's gonna be another episode.
All right.
For sure. Alrighty. What are some risks associated with using social media for health advice?
We kind of already said it.
You want to take that one?
We can.
Yeah.
I mean,
Some risks are like misdiagnosing or
mhm,
worsening a condition. Um, delaying proper medical treatment. A lot of people will be like, "Well, they told me online that um I don't need to be seen, but in reality you do. And then by
mhm,
the time you are seen, the condition is worse.
mhm.
Um taking unsafe or unnecessary supplements
Yes.
is a risk. A
Mhm,
lot of times people are already on prescribed medications and then you include a natural supplement, which y'all know I'm not anti-natural supplements at all, but a lot of them do interact with prescribed medications, and
mhm,
you have to know and fact check that to make sure that it's not going to interact with
mhm.
your blood pressure medicine or your diabetes medicine that you're already taking.
And
Um,
go ahead. Go ahead.
no, you go ahead.
Oh,
I
you
think that was
well versed in that area.
Look, y'all, I'm not anti the natural, but we talked about that on healthcare is a scam. So
Mhm. One thing I wanted to say, I was reading something that inside some of those natural products, you might be allergic to things in that.
mm,
So you really have to be careful, and they're not FDA approved,
yeah, a
which
lot
means
of
they
them aren't.
hadn't really been tested to make sure that they are okay. They're not going to really harm you. But to pick it back off of that, natural herbs are medicines, and medicines that you get from your doctor most of the times have been natural, are kind of natural too, to a certain extent. So like there's natural, and then you have added chemicals to it from the. Am I making sense there? Like,
Yeah,
oh,
yeah,
it's kind of,
yeah.
I'm trying to explain it. So in a sense, from its element, it's probably got some natural qualities to it, if that makes
Right.
sense.
Yeah.
But then there's been things added to it to make it stronger or better for you. So that's why she's saying make sure you're, you know, fact checking and making sure it's not contradicting or causing issues with the medicines that you're on, if you're on them.
Already taken. Right. Yeah. All right. What are some popular health trends on social media right now? And are they based on sound medical advice?
Hmm.
Detox teas. Ooh, they gonna hate me for this
They
one.
are. They are.
Okay, so this is the internal shower, as they call it. It's a mixture of chia seeds and water and lemon. Now, y'all, I do this one. Okay, I do this one. However, the misconception. So it's said that it helps you lose weight, right? But the reality is chia seeds are high in fiber, and we know that fiber, regulates constipation. It also can decrease bloating. So, yeah, it's not necessarily going to help you lose weight, but it can help with bloating, and it'll make you feel better if your pants are super tight. So yeah. But I actually like that one, y'all. But I wouldn't get on here and tell you that you're going to lose 15 pounds doing it. But yeah. So that's one of them, the internal shower. Um what's another one we have?
We had
The
the pre-workout.
oh the okay, I don't know if y'all seen this health trend. So it's called dry scooping, I
Mhm.
believe. So you know how people take pre-workout powder, but you're supposed to mix the pre-workout powder in water. Well, people believe that if you just take the scoop of pre-workout powder without mixing it in water, then you have the effects faster. However, that can cause heart palpitations and increases the risk of choking because of the high content of caffeine as far as the palpitations go. And then obviously because it's just dry powder, why you could possibly choke.
Right.
So, yeah, that's one.
I would say one thing I saw on Facebook just recently was a detox tea. I think it was like in Spanish. It's called Peñalum. I don't really know if that's how you pronounce it, but I think the person who posted was like she saw that that person lost like 25 pounds. Did I send it to you, Terry? Let me see.
Yeah, I think you did. Yeah.
Like 25 pounds.
Okay, so detox teas. Um And we'll throw in just laxatives in general because essentially a lot of detox teas have laxative properties or laxative ingredients, I should say. So like centerleaf. Um, but the average person can carry between 8 and 25 pounds of fecal matter in their intestine colon, right?
Mhm.
Um, and so a lot of times these detox teas you're losing weight, but it's really just you were constipated and you had so much fecal matter built up that the detox tea is releasing that fecal matter. Now, yes, you'll lose weight on the scale, but is that true fat loss? Is that true muscle loss? Like you can break it down. You can break down weight loss, right? Or are you losing water weight?
Mhm.
However, doing a good cleanse before you start a health journey is a good idea because once you start eating right, then your body is able to better absorb nutrients. But yeah,
Mhm.
you just have to be weary because you'll come, Mikhail, won't they come in dehydrated?
Oh, absolutely. It nerves me because like this person said they were on IG influencer for natural weight loss, and it's as good as Ozempic.
Yeah.
Y'all, pooping is not the same as like you, like Terry said, you gonna lose weight. You're not losing weight. You're just shedding off waste. And
Right.
yes, you can be dehydrated. Like I will always say, talk to your provider first before you start extreme stuff like this. That way you'll know
Yeah.
if your kidney functioning is okay. Like there's different things that you need to make sure is okay before you start these things, because then like if you get too dehydrated, you can go in kidney failure. Um, the study that showed, like you said, a person can hold between 5 and 25 pounds of stool.
Yeah, 8 to 25. I
Eight to
believe that was
25.
from Liberty Clinic.
Yeah, like that's true. And like the conversation we had earlier was like, if you get to the point where you got like 10 pounds of stool, you gonna know. And like you
Oh
probably
yeah,
need to
you're
go
gonna
to the emergency room.
been okay, TMI, been there, done it. We're not gonna go into the story, but been there. It happens. I mean, you can get constipated. So
But to
yeah.
use a drink to lose weight is probably not there's not a probably. It is not healthy. Okay. It does
Yeah,
not
especially
compare
not long term. Not long
long
term
term.
at
No.
all.
It does not compare to Ozempic. It does not compare to Mounjaro. It's not the same stuff. And you're not being medically
Yeah.
managed on the stuff. All right. We're off
Right.
our soapbox with that.
I know, right? They not gonna like us for that one, but okay.
I know, right? They'll be all right. Accountability. You gotta learn so you can do better. We learn.
Right. You know better, you do better.
All right. Is it my turn
All
or
right.
yours?
I have no idea. Go ahead
Okay.
though. Or no, I'll pitch it to you. I'll pitch it to
Go
you because
ahead. Go
this is
ahead.
a good one. You being a practitioner, this is a good one.
Okay.
How do you feel about patients bringing Dr. Google to appointments? Is it helpful or annoying?
I think it can be helpful. It's a little bit of both. I mean, I'm kind
Yeah.
of in between with it. It's helpful because it's like, okay, when you're doing research, you're trying to learn more. And now that Google has AI, I think it'll be a little bit better. As far as like fact stuff versus I got cancer every time you search for something.
Yeah.
But I think it's helpful. It can be annoying, especially when you're trying to tell that the provider, hey, I think it's a fine line. Come in with
Yeah.
your
Yeah.
information and that you've been well informed. And it's always collaboration between you and your provider, which is why we're like, make sure you are literate in your health issue. So that y'all can come up with a plan together. The whole point is so that you guys can come up with a collaborative plan to best benefit, the patient. So
Right.
it's annoying when my expertise is like, no, this is not going to be helpful for you. And these are why. And yet you still bent on, or this is what Google said, and I think I need this.
Yeah.
Case in point. Go ahead. Then I go back to it.
No, I was just gonna say it's really good having informed patients, who ask thoughtful questions because that leads to more meaningful conversations, right? When you come in with the background knowledge on your condition or potential condition, then we can have more open dialogue than somebody who comes in who doesn't know anything about what we're talking about, right? But when you rely heavily on Dr. Google, then you can come in with misconceptions and that makes it harder to correct the misinformation, right? So then they start to question like your expertise and they're like, you don't know what you're talking about, right? Because they're so set on what Google said. So it's important that we strike a balance between being informed and using our resources, but also trusting expert advice.
Absolutely. You summed it up
Yeah.
very well. So,
Thank you.
fine line.
I've had patients come in with a full treatment plan in the clinic.
Yes.
They telling us what we about to do.
Yep.
And I'm like,
And that
okay.
very annoying. On the inside, it's like on the inside you kind of tickle, but then you kind of burn it up too. Kind of like, okay, man, you gonna let me do my job?
I mean, I really appreciate it. I'm not gonna lie. I feel like it takes a lot, or I think it says a lot about a person that will research their situation. But to have a whole treatment plan, hey, I can't knock it.
I mean, you can't. It helps you out a little bit. Be like, okay, well, let me see what you got.
Right, let me see what you got. Let's see where we at. Let's see. So, yeah.
It's helpful. Just keep in mind that that person, has been trained and may have to curtail it a little bit.
Right.
Yeah.
Right. Yep.
All right.
Alrighty. Well, we hope that you all learned something interesting, new. Of course, as always, we want you to subscribe and we want you to give us feedback and drop any questions that you all have. We can't wait to see you all on episode 3.
All right. Y'all have a good one.
All right. See y'all.